Greetings and welcome to another edition of Trap Omanye Royal. Today we have with us a well-renowned doctor, and he's here with us to share insights with us today.
Bonjour, ma reine Vickylextar.
Bonjour.
Cha Omanye Abba.
Yao.
So, my name is Sir Dr. Pierre St. I am Director of Health and Allied Services for Omanye Royal Kingdom. I am a practicing physician in Canada. I have been practicing for 32 years. My expertise is in orthopedic medicine, emergency medicine, and pain management.
All right.
I'm here to answer a few questions.
Well, thank you. So, being a doctor who's traveled around the world, you've gone to Dominican Republic, Haiti, India, St. Lucia, Ghana. What are some of the biggest health challenges around the world today?
Well, to personalize a WHO version of this answer, I will explain that in my youth, as a medical student, I was passionate about what we called at the time international cooperation. Today, the term has been coined into global affairs and global health. When the name changes, it's usually because things are not going that well. Now, I was passionate. I traveled many countries for many months, and the truth is, the conclusion was very, very negative, and that's why I turned my attention to Canada for so long. But now the occasion is miraculous. I have a chance to go back to this first passion via the Omanye Royal Kingdom, where the intentions are purely for the interest and respect of humanity, and without all those political self-interest that I witnessed while I was traveling and working abroad. So what are the problems today? They're the same they were 32 years ago, and they are probably worse. So what literature will say, and it is correct, I'm not changing what literature says, the base of the problem is public services, public health. It is accessibility to drinkable water. It is accessibility to water in sufficient volume to wash oneself and wash one's home. It is accessibility to sewage system to clear all those dirty, infected waters. It is toilets or latrines to eliminate the dispersion of all these bacteria. And that is still true today. So what I found in literature recently is that there's still 50% of Africans that don't have access to these public services. And that's the source of disease at a very high level. Then the second problem, which existed but was less apparent, is the health systems. Now, Africa has tried to import Western health systems, and the West has tried to export Western health system. But today, these health systems are barely sustainable financially in Canada. So imagine the situation in Africa. The population of Ghana is practically the same as that of Canada. Our growth, the domestic product, is in the 300 billions. Ghana is in the 3 billions. We put 13% of our GDP into health. They put 3%. We are crashing with this 13%. It is obvious that in the last 10 years I've seen everything deteriorate. And then with COVID, it has just accelerated everything in Canada, in Africa. And what is even worse now, and that's a recent problem, is shortage of manpower. Services are shut and cut down in Canada the same way they're being eliminated in Africa. So it's impossible to export our health system to Africa, and Africa is drowning in trying to do the same as we are doing.
Dr. St. George, you were part of the recent group that went to Ghana to visit mothers and children and to begin to give help. How was that experience for you?
Now, to make this more personal, we have gone to Ghana last year, and I have visited a university hospital, which was functional, rather well equipped, but there weren't that many clients because there's a user fee. But it was fairly impressive. So Ghana has imported a Western university setting, which cannot provide for the country for financial reasons. Yes, they train people. Yes, but then the other problem is African brain drain. A lot of these professionals leave Africa. So that's a big, big issue. But I have visited these university settings, and then we have gone in the regions where I've seen some regional hospitals where the infrastructure was quite impressive, but there was no one in the hospital. And I've seen that in many other countries. And then we went to a community hospital, thinking we were to meet the chiefs. The meeting was to be, had they known, they would. The reason why they did not organize it there is because the infrastructure is totally absent. That building was totally empty. There were no medical equipment, a few naked medical beds, but the place was empty of material and people, and that was their community hospital. So then they sent us to a health dispensary, which was newly built, but again, it was empty. No medical equipment, and 2 midwives who were desperate to meet us and find a way of getting material and assistance. So the pyramid is more or less working at the top with the university setting, but after that it crashes because financially you cannot sustain it.
What are the main barriers to healthcare access that you've identified in the communities that you serve, and how does Omanye Royal Kingdom plan to overcome these obstacles?
So we from Royal Omanye Kingdom have to reinvent or at least tweak the wheel so that it turns. And the only way to succeed in this, because financially it's not sustainable for us either unless we reinvent this wheel a bit. And I should not say reinvent, because we will tweak it. We take what is there and improve, adapt, assist. But we have to do it locally in one community, set an example and spread it. That is how I see it.
Thank you for your insight. So when you say that the exporting of the medical system is not working for Africa and some of these other countries, what do you really suggest? You said it towards the end of your last answer, but what are the practical things Omanye Royal Kingdom can do to actually tweak these things so that we can actually use the resources we have effectively?
Okay, it is possible to offer medical services economically. We do not need huge infrastructures or huge technologies and huge pharmaceutical setups. An ER can function with very little. A pain doctor, orthopedic medicine doctor in his cabinet as I work can do a lot more than what a hospital setting with its huge heavy infrastructure offers. So there is a way of tweaking the system economically. And then these public services have to come with education. The people have to be the drive. They have to be the drive in their public services. They have to be the drive in their medical system also. So there is huge education to provide. It's not just for the midwives and the potential nurse assistants. It'll have to be community oriented.
Right. So are you excited to be part of this change in Africa and beyond, using our resources for a more sustainable healthcare system?
It is my dream.
Well, you've heard from Sir Dr. Pierre St. George. Cha Omanye Aba.
Cha Omanye Aba.